Hello, everyone. Welcome to Barod Bitesize, a series of bite-sized learning sessions as part of our Learning at Work Week celebration. In this session, we'll be looking at substance use and the LGBTQ plus community. So what is Barod? Barod is the Welsh word for ready. We are a substance use charity based and operating across South Wales, and our aim is to support anyone ready to make a change or make a difference to their lives and the lives of others. This means we provide high quality, free and confidential support and guidance to anyone who is affected by either drug or alcohol use, either their own or someone else's, and raising awareness about the ways we can all help to reduce the harm caused by substance use. In today's session, we'll be exploring substance use and the LGBTQ plus community, and in particular, examining the UK data surrounding the LGBTQ plus community and substance use, exploring some of the root causes of substance use within the LGBTQ plus community, and examining some obstacles LGBTQ plus people face when accessing health or well-being treatment. I know it's a familiar and often quoted acronym, but I just wanted to briefly expand on what LGBTQ plus means, just in case some people are familiar or may want a quick reminder. The LGBTQ acronym stands for lesbian, gay, bisexual, transgender, and queer. The plus sign is used to represent the many and wonderfully varied gender identities that aren't necessarily included in this acronym. So what do we mean by the term substance use? In the past, you may have heard terms like substance misuse or substance abuse when talking about people who use drugs and alcohol, but we at Barod would like to start moving away from using phrases which carry emotionally loaded language or negative connotations. As one of our many insightful youth ambassadors said, behind someone who uses substances is a human being with a life, and labels don't take you there, only to a negative place. We prefer to use the term substance use to describe anyone who is currently using drugs and or alcohol to help reduce the societal and self-imposed stigma. If you'd like to learn more about why language matters, we have a comprehensive terminology guide, which will be linked in the description of this video. In 2022, 3.3% of the UK population aged 16 years and over identified as gay, lesbian, or bisexual, a continued increase from 2.1 in 2017. For the first time in 2021, the UK Census asked the question, is the gender you identify with the same as your sex registered at birth? Only 262,000, around 0.5% of the population, answered no. Those who openly identify as part of the LGBTQ plus community in the UK are a minute fraction of the population. However, research over the last 10 years reflects a worrying trend for the health and well-being of the community. They are not only statistically much more likely to use drugs and alcohol compared to the heterosexual and cisgender UK population, but are also at an increased risk of developing dependent use. Older figures in the crime survey for England and Wales suggest that substance use amongst gay and bisexual men was 3 times higher at 33% than use amongst heterosexual men at 11.1%. For lesbian and bisexual women, the use is more than 4 times as high at 22.9% than for heterosexual women at 5.1%. UK Stonewall's report in 2018 shows similar discrepancies, finding that 9% of LGBTQ plus people in Britain use drugs at least once a month for a year versus 2.6% of non-LGBTQ plus people. The same report by UK Stonewall found that 1 in 6 LGBTQ plus individuals drank alcohol every day compared to 1 in 10 of the UK general population. The reasons behind why there is such a higher prevalence of drug and alcohol use within the LGBTQ plus community are complicated, multifaceted, and largely shaped by our societal structure and prejudices. But some of the most common causes include mental health and stigma. The mental health and emotional toll of grappling with one's sexuality or gender identity can be significant. Many individuals within the LGBTQ plus community experience isolation, discrimination, and bullying from within the family, wider community, and in particular education. No one likes to feel isolated, so the emotional stress of unsupportive or threatening environments can lead to issues with self-confidence, identity, and internalized homophobia or transphobia. Some people may turn to substance use as a coping mechanism. Trauma. LGBTQ plus individuals are more likely to experience higher rates of trauma, whether emotional, physical, or sexual, compared to the general UK population. Traumatic experiences, especially during formative years, can increase the risk of developing substance use-related health risks in later life. Discrimination is a significant contributor to trauma. Unfortunately, many LGBTQ plus people face discrimination at some point. It's also incredibly important to note that recognizing intersectionality is vital when understanding the multiple layers of discrimination or different traumatic experiences someone may face. A queer person who is also a person of colour, disabled, or comes from a lower socioeconomic background may face more intense and varied forms of discrimination. According to Stonewall UK's report, 1 in 5 LGBTQ plus individuals experienced a hate crime in the last year. 2 in 5 transgender individuals were victims of a hate crime in the same period. 1 in 6 LGBTQ plus people experience discrimination in a social setting such as bar, club, or restaurant, and 1 in 4 BAME LGBTQ plus individuals experience discrimination when accessing social services. Social environments and community. A lot of the LGBTQ plus community's history and survival is rooted in nightlife and club culture. Throughout the 19th and 20th centuries, bars and clubs were often some of the only theoretical, safe, private places where LGBTQ people could meet and gather openly, especially when their love and expression were criminalized or heavily stigmatized. Many landmark LGBTQ rights movements have roots in bars: the Stonewall Inn in New York City, Heaven and the Royal Vauxhall Tavern in London, or the Golden Cross in Cardiff. These venues often lent their rooms and taps to activism and allowed people freedom who otherwise had no common public gathering place. While, of course, these clubs and bars can be a space of liberation, like all bars and clubs, throughout the normalization of alcohol, it exposes people to a high level of general substance availability. Discrimination from within services. Historically, LGBTQ plus people have often had specific health needs overlooked or received unequal treatment from healthcare professionals. Some LGBTQ plus people feel they cannot be open about their sexual orientation or gender identity when seeking medical treatment because they fear unfair treatment or invasive questioning. According to Stonewall UK's report, 1 in 8 gay, lesbian, or bisexual people have experienced some form of unequal treatment from healthcare staff. A third of trans people have experienced unequal treatment. And 1 in 10 LGBTQ plus people have been outed without their consent by healthcare staff in front of other staff or patients. 1 in 4 LGBTQ plus people have witnessed discriminatory or negative remarks against the community by healthcare staff. 1 in 20 lesbian, gay, bisexual people have been pressured to access services that are supposed to change or suppress their sexual orientation or gender identity. And specifically, 1 in 5 transgender people have been pressured by healthcare professionals to access services to suppress their gender identity when accessing healthcare. Chemsex. Chemsex describes the use of specific drugs like methadone, poppers, and GBH during or before to enhance the sensations or help reduce inhibitions. During 2011, various public health organisations have observed the growth of chemsex amongst gay and bisexual men. In London, the Metropolitan Police Service reported 262 chemsex-related offences, a stark rise from just 19 in 2018. The London Ambulance Service suspects at least 1 call-out per day is connected to chemsex, and the NHS has started to devise specific treatment strategies. Chemsex can significantly increase the risk of overdosing, contracting STIs, or developing long-term health-related issues. Obstacles to treatment. Unfortunately, there are several reasons why LGBTQ plus people might not feel able or ready to access medical treatment or well-being services. These factors often involve a mix of personal, social, and systemic factors that can be wholly dependent on the individual's geographical location and access to resources. These include feeling fears of shame or fear about seeking help. Issues with internalized homophobia or transphobia can create barriers to accessing health and well-being services. Some people may struggle with the belief that they don't deserve support at all. Lack of trust in the healthcare system. Previous negative experiences with healthcare providers can leave LGBTQ plus people feeling unwilling or unable to access care. Concerns about confidentiality and privacy can also arise if an LGBTQ plus person has been previously outed or experienced discriminatory behavior from healthcare professionals. Cost and accessibility issues. People from geographically more isolated areas and or lower socioeconomic backgrounds may struggle to access health and well-being services due to lack of transportation, time to reach appointments, and or financial constraints. In the political climate. The ongoing media and political discussions about the lives and rights of the transgender community in particular has had a serious impact on the safety and well-being of the trans community. It's unsurprising that so many people feel discouraged or fearful of seeking not only gender-reaffirming care, but any health or well-being service. In today's Barod Bitesize session, we explored the complex relationship between substance use and the LGBTQ plus community. Thank you for taking the time to watch this video. We hope you found it informative. We offer a range of training for external services, and if you are interested in learning more, please email us at training@barod.com. Please also follow us for updates about what Barod is doing and updates on the campaigns we support. Thanks again for watching.